At Northwestern Health Sciences University, graduates never stop learning, and that was very clear at the college's Chiropractic Homecoming.
There are vendors here representing all kinds of different chiropractic and health and wellness products and services. We have educational seminars and classes taking place so that chiropractors can get their continuing education credits and also learn a bit more about what's happening in the field and how they can advance their professional skills.
A priority for Northwestern. President and CEO Chris Kassir says the college has 870 full-time students, but when it comes to opportunities like this,
we have about 7,000 continuing education students at Northwestern. So people often think of us as the small institution over on 84th and Penn, but when you add all of the continuing ed students and the folks who are here on campus today, it's clear that we're a mid-sized university here in Minnesota.
That constant learning is a big draw to this event, where graduates and professionals from around the country gathered.
There are so many providers out there that are working harder than I am in their office helping the community with their chronic pain and their acute pain issues, and they don't necessarily have the time and other resources to dig into the research and basically self-learn.
That's the director of the Human Performance Center, Timothy Stark. He spoke during a workshop about concussions and the neck.
I feel that the neck and the symptoms potentially associated from neck trauma are not being thoroughly evaluated. It's one thing to have traumatic brain injury and actually seeing anatomical findings for traumatic brain injury, but a lot of MRIs are negative for actual anatomical brain injury, but they still have symptoms consistent with a concussion. And are those symptoms really coming from some sort of pathophysiologic process within the brain, and or is the neck involved? One particular study said if you can increase the neck strength by even 1 pound, it may decrease the incidence of concussion by 5%. That's substantial.
In another classroom, people were practicing balance to learn about posture, a big factor when it comes to back pain and falling.
If your balance is physically off, your muscles are working with that asymmetry, and they get stronger in that asymmetry. And instead of your feet moving evenly, your feet are moving more asymmetrically, making the possibility of your toe hitting the ground instead of clearing the ground, and you having a fall get even larger. 1 person out of 3 over 65 falls every year, according to the CDC. Once somebody's had a fall, there's a 50-50 chance of another fall within 6 months.
So what can you do to prevent these problems?
The beginning of improving your posture is benchmarking. It's seeing what it looks like.
Dr. Stephen Weiniger said apps like this one here can help you track your progress. He took a picture of yours truly and mapped out where the different parts of my body fall in line with one another.
Strengthening balance, strengthening alignment, and strengthening motion, or as we say, strengthening BAM, is how you strengthen posture.
And these non-invasive methods are what Northwestern is all about.
It's like your grandmother's medicine, right? That, you start out with a cold and you have tea with honey and lemon. If it doesn't get better, then you try something more aggressive. But you begin there. Getting enough sleep, working out, exercise, eating right. Those are all also part of the heart of what we do here at Northwestern.
A practice that gets better with practice. Every year with learning like this.